Ryan Stanton here with ACEP Frontline from Leadership and Advocacy Conference, and we're talking about some federal today with Dr. Joseph Leary, or Joe Leary. He is somebody coming out of Colorado, and we'll get that story at some point, but also talking about your involvement. If you get the ACEP Now publications, you may have seen the March 4th publication, A Physician Goes to Washington, Lessons from a Year in EM Advocacy. So a great article to read there. So if you want to read about it and see some beautiful pictures of the Capitol with the red buds and all that type of stuff, or whatever they're called. All right, first and foremost, welcome to the podcast. I appreciate you being willing to come in and talk with us. Give us a little background on yourself.
I'm a overachiever at heart, and a Notre Dame alum and football fan. I live in South Bend, Indiana, and that's where I grew up, though I was born in Missouri originally. I'm just somebody who wants to be part of improving the profession.
All right, so give us a little background on how you became more interested than the average bear with regards to the politics of medicine.
I am always somebody who has trouble staying silent, and I'm somebody who was annoying at undergrad and raised my hand every time in class, asked questions, and I consider myself a very curious person. And so during residency in Chicago, I think I got a little burned out, and so I started asking questions. Why are we paid this much, and why is this done that way? And so by the time I was done and attending and board certified, I had built up an arsenal of questions and concerns that I think laid the groundwork for wanting to be part of the solution to those various pain points in my training and career.
So talk about how the involvement of your first job as an emergency physician and how that kind of played into some of this.
I was ready to get out into God's country. Steamboat Springs, Colorado is one of the best ski resorts in the world, and I had friends there that had shown me the way, and so I took a job in the neighboring town and worked 24-hour shifts in Craig, Colorado. Commuted that 40 miles, 7-8 times a month, and snowboarded whenever I could. Went hiking, camping, hot springing. Really loved the work-life balance out there. But when they closed the labor and delivery unit, I started to think, dang it, here we go again. The business of medicine's screwing it all up. All
right, so let's kind of dive into what you're doing this time you spent in Washington, D.C. Kind of walk us from that closure of the labor and delivery unit, the frustration over access that you saw there, and how that proceeded to you being up here in Washington.
Life was good, and then suddenly we were told by the CEO, who's a good guy, I don't have any problems with him, that due to financial solvency issues, we couldn't afford to keep the labor and delivery unit going. And that wouldn't seem like such a big deal, except that Craig, Colorado is in a medical desert. We would routinely care for pregnant women in Wyoming, Utah, and southern Colorado. So we knew that even though we were going to close our labor and delivery unit, that these women would probably still show up in labor, and we were going to have to deliver those babies, potentially, nuchal cord, shoulder dystocias, breech deliveries in a relatively isolated space without any ability to, well, I guess we could transfer them, but you can't transfer active labor patients. So we just, as a small group, saw the writing on the wall and said, oh, geez, this job, may not be quite as savory anymore. And some of the docs left, and others started to figure out, what they were going to do next. And I started to think maybe getting a master's in public health and, getting more involved in ACEP was a way to channel that frustration.
And so you have this situation. That's interesting because actually I saw the news story this morning where they delivered a baby on a Delta flight yesterday. My last 2 deliveries in my emergency department, even though we have a birthing center, we're 2 active labor, full breech coming in, and then as well as a twin twin ruptured uterus that we had. So that's emergency medicine in general is not just the births that go normally, it's the births that have gone full sideways. And so, exactly right, with EMTALA and everything else, you've got to deal with it. And so how does that transition to becoming a legislative fellow in Washington, D.C.?
That initial pain point, if you will, thinking about the need for this isolated hospital to stay open, but having to sacrifice providing access to some of the most vulnerable people in the community, seemed like to me where the rubber met the road. It's where policy and politics and healthcare all intersected. So I think that the problem I encountered in Craig, Colorado, is the one that everyone's encountering everywhere else. And so I sort of took a deep dive and made understanding the policy my side quest, and then as a Harvard School of Public Health student, used that as a pretense to write essays and sort of plumb the depths of the issues that led to that closure. And so when I came finally knocking on Senator Cassidy's door and I got interviewed, I was very well equipped to speak about it. And I think that captivated at least his senior policy advisors who I ended up working for.
So how does that transition? A physician, of course, there couldn't be a more different environment for you, going out to God's country and hiking and hot springing and skiing and steamboat and all that stuff. Washington, D.C. is just the opposite of all that. So the environment is completely different, but you're, here now in this unique environment as a physician working within the office as a legislative fellow of a U.S. senator. Talk about that and that interaction and how you feel medicine plays an important role of being involved in that type of position.
Well, Senator Cassidy is an MD, and he, of the 4 doctors that are currently U.S. senators, he's probably practiced the most medicine. Barrasso from Wyoming is an orthopedic surgeon. Rand Paul's an ophthalmologist. And Marshall's an OB-GYN. Cassidy was a gastroenterologist. He's an internal medicine doc. His wife's a doc. Mm-hmm. And so he sort of became successful through clinical medicine. They say healthcare policy is an expensive hobby. And so I think he's doing it because he cares. And so when I met him, I was immediately talking to someone on a side from all of his power and esteem, another colleague. And so he treated me like another doc in the doctor's lounge. And that probably bred some contempt and jealousy from, other folks. But I thought that was really special that, we had that shared understanding of, being an intern, in a busy hospital. He's a great guy. And so I think that's partly, why he stamped the approval to let me work for him for a year.
And if you, everybody listening out there right now, if you said this opportunity, why would you say is a potential good consideration for other emergency physicians out there?
I think our specialty is getting harder. We're, every year fighting to keep our compensation adjusted to inflation, so we're objectively being paid less. And as the boomer population in the United States ages and becomes more comorbid laden, our job's objectively getting harder. We're being asked to do more with less, and so it's easy to get frustrated. And so if you want to quit the job and burn out, that's one avenue, or you can take that frustration and angst and go to DC and try to be part of the change. And so that's one option that you could do, like I did.
Give me the kind of the daily of what a legislative fellow does here in Washington, D.C.
Well, my experience as a fellow was different, I think, than most, because I came unaffiliated, and they had me go down to the Senate HR office and take an oath. I was on the Senate payroll for, I think they paid me $2,000 for the year, and that was invaluable.
So it's like jury duty at that point.
Yeah, so I functioned as a staffer. So I was able to take meetings on occasion when approved with constituents, and I had a portfolio that I managed. that included durable medical equipment, advanced care planning, end-of-life issues, and then rural hospital legislation. So I was emailing the Senate Legislative Council. I was getting a bill scored with the Congressional Budget Office. I was staffing Senate Finance Committee meetings, or I was going to the meetings and taking notes and reporting back to the office. So I got elbows deep in the policy work.
Now, how do you think that impacts you moving forward? I assume you're not going to stay up here as a fellow forever, making $2,000 a year unless you win the lottery.
Well, what I found coming back 6 months later is that the people I worked with are still like pleased to see me, and so I built a social network, and all of them are much more knowledgeable about Medicare and Medicaid and policy than I am. I learned a lot, but if you've worked in a senator's office for 10, 15 years, you know, you're in the top 1%. So more than getting a free education, I built a network of people to ask questions, and so I feel like now on the Federal Government Affairs Committee or the Communications Committee, which I'm on, I can help the college, you know, by participating and even being a connector.
Well, let's talk about that a little bit. You've now seen it from both sides. You're active. You had a voice, which isn't always the physicians often sit in the background, assuming somebody else is going to tackle the issues or raise their voice. And you've been active from the advocacy side. Now you have experience from the inside of one of the highest-ranking senators in this country. Kind of translate that as physicians become active in advocacy. So just like we're doing up here, and we're going to go to Capitol Hill on Tuesday, what would you give in terms of advice and tips for physician advocacy to be effective when they're coming to the offices of these senators, representatives, or whoever it may be?
Sure. Being early is being on time. There's a lot of egos involved. If you show up late to a meeting with the U.S. Senator, they may be gone already. They may send their junior staffers in. So be early, be prepared, know which committees your senator sits on and which jurisdictions he has influence over. It's different in the Senate versus the House. Senator Cassidy was the chair of Health, Education, Labor, and Pensions, and helped approve all of the nominees that President Trump appointed. So that was his most powerful role. But he also sat on Senate Finance Committee, which oversees all of Medicare and Medicaid. So just that sort of basic context is important to come to the Hill knowing. What else would I say to other docs? Just remember that we're one of many specialty societies, and a lot of times we're all advocating for the same thing, and so there's no need to rant or try to lecture the elected official, and that perhaps like the greater result of this meeting could be rapport, because if you come to LAC multiple times, you might meet the same representative or senator over and over again, and DC is all about relationships. So I'm trying to think what else I would suggest. I mean, you could also, to other docs like residents or fellows, if you want to take a pay cut and go work for a senator, they're eager to have ER doctors. I mean, the show The Pit came out. There's never been a better time to be a vocal ER doctor, and boy, they'll listen. The staffers and elected officials when a board certified emergency medicine physician speaks up, because they've seen the show. Most of them have been to the ER. I think there's 140 million visits a year in the United States, so 1 in 3 people wandering around have been to the ED. So it's a very personal thing. We have our fingers on the pulses of the communities that we serve, and so bad policies show up in the ER pretty quickly, and so they want to know what ER docs think. There's a lot of respect shown to any doc who wants to work in policy on the Hill.
And you mentioned rants, and I think we as physicians are just globally, physicians aren't known as the most agreeable people when it comes to politics. When a physician comes to the office, what's the best way in terms of communication of getting a point across or telling a story without getting into the rant, without kind of, causing any friction that is there? Because it's so easy for us to get up there and just kind of unload.
Yeah, for sure. I think if you just put some context to the situation and give the actual elected official some grace, they'll perceive that quickly. There's only 435 representatives on the House side, and there's 100 senators. So there's 535 people representing the whole United States of America. And so our country's built on compromise. And just because Senator Cassidy, let's say, allowed RFK Jr. to be confirmed, doesn't mean that he espouses everything that the Secretary of HHS is doing, and that inevitably your at least in the Senate, allegiances are going to be split 380 million ways. And so if you just come into that knowing that your elected official may still want to do what's best for the United States of America and not your own interest, because, he's got a whole state of people who elected him to prioritize.
It's interesting you mentioned that. During one of the meetings today, we talked about people being against who ACEP and IMPACT support and saying we're against this or that or whatever it may be. And one of the physicians there said, well, I love my wife and we don't agree all the time, so there's no way I'm going to agree with my politicians all the time. We have to support people who can move healthcare, emergency medicine forward, even if we don't agree with all their politics or all the things that are involved, especially as a college that represents the full breadth of political viewpoints. I want to, before we wrap up today, I want to be able to kind of a little cheat sheet, curtains back again. What are the things when you hosted a meeting that would almost immediately turn you off in terms of thank you for the information straight into the file cabinet, which happens to be a shredder?
I can't speak for the senior policy advisors that were with me, because I pretty universally was number 2 in the meetings.
Mm-hmm.
But I certainly clammed up and shut down when someone across the table asked me how I got there. Or quickly, gave off like, what the heck are you doing over there? Like, you're a nobody working for a senator, or any kind of condescension, really made me clam up. So I just I think that would be something to keep in mind, that the people across the hill, though they might be like 24, 25 years old, they're pretty sharp, generally speaking, and accomplished. What else was a non-starter? Anything that seemed fraudulent. Like, we had a lot of constituents come to request meetings that they pretty clearly were motivated by wanting to profiteer or make more money, and oftentimes the federal healthcare budget is at odds with the success of a big Fortune 500 company. Healthcare's, I think, 33% of our federal budget every year, so that's almost $3 trillion that we're spending right now, and I think we're up to $38 trillion as a country in debt. And so when a constituent comes to the federal government and is asking for policy changes that aren't going to save money, but will result in more profit-driven motivation, it just started to seem like an eye roller. That we were just humoring rich guys, and remember, the staffers, they make $40,000 to $60,000 a year. They're paid like a resident, and so they think of doctors as rich guys. So most ER docs, working full time, make $350,000 a year or more. So if you come off as like a rich guy asking for more money at the detriment of the U.S. federal budget, then you're gonna get eye rolls. I think so. That's kind of how I felt about it. Could be wrong.
And I think the staffer conversation is very important, because I almost inevitably like to meet with the staffers more, because they are so educated and they're the ones that actually drive the information. Mm-hmm. When you talk to the politician, especially one that you mentioned earlier, who's always late, by the way, it's you just get a political sales pitch. Whereas if you're with the staffer, you actually have that conversation. And I think that's very easy when you have that 22-year-old or 24-year-old staffer as a 49-year-old physician coming in there of feeling like it's very easy to, so what are you doing here? Your parents know you're here? And very easy to turn them off. Let's go opposite to that now and say, what are the things that were like automatic? They come in with this type of approach, this type of message, and you're like, remember, Dr. Cassidy, this is worth looking at.
I remember the Colorado Rural Physicians Association came in, and they passed us across some pre-drafted bill text. They gave us text. They said, this is what we think needs to be done, and this piece of legislation could be plugged into like the Social Security Act with a minor tweak. And suddenly, if implemented, would allow hospitalists and critical access hospitals to bill for standby time. And so that was a piece of legislation that I actually worked on. So we had a good idea from a group of doctors who flew in from Colorado. They gave us draft text, which was impressive, and they showed us their theory of change, which is critical access hospitals, like the one I worked at in Colorado, are billed on an annual cost per cost basis. So they just turn in all their costs at the end of the year, and the federal government pays them at like 101%. So if they said if physicians who are working 8 hours a day, but really on call 24 hours a day, could add those additional 16 hours to their cost reports, then Medicare at the end of the year would pay them, for 16 more hours every day, which would result in like $30,000 a year of discretional funds for every critical access hospital in the United States. It served their interests, but they painted the picture for us, and I said, that's a golden idea. Like, that's a common sense, obvious idea that fits with the conservative agenda of bolstering care in rural parts of America that Senator Cassidy would be interested in, because Louisiana has a lot of critical access hospitals. So Parker and I think in that meeting talked afterwards, said, hey, this is a great idea. Look, they gave us the legislation. Can I send that to the Legislative Council and see what they think? Send it to the Senate's lawyers? And I said, yeah, sure. And boom, we drafted a bill, and it's still in circulation. But that was an example of a group of doctors that came in, prepared, and it turned into draft text. It hasn't been introduced yet. It might not get introduced. Remember that only I think 4% of bills introduced in the Senate get enacted into law. So, but that's an example of some docs that did it the right way.
And it's a long game. Politics, especially on the federal level, it's going to be a long game. Everything we do from a ACEP legislative standpoint, we expect at least 10 years for something to materialize and make some progress. So any closing thoughts as we wrap up today, the messages that you will tell here to LAC in the coming days, any closing thoughts to the thousands of physicians that are listening in who are debating on being active and being involved in their states and federal and actually doing the advocacy of EM?
My closing message would be that get outside of your echo chamber and engage somebody who has different political views than yourself. That change starts small. Figure out who your state representative is, who's going down to Indianapolis. I recently met Joanna King, who represents the area that I live in, and And then believe in yourself. If you want to go spend a year with a senator, I'm sure that one of them will have you. I mean, it's it's not it's not as difficult to end up in a senator's office than as you might imagine.
But it's not a good get rich quick scheme.
No,
Clearly.
but it's a make a difference quickly
Yeah.
scheme. So yeah.
So if you're looking for that opportunity, talking with Dr. Joseph Leary, who ended up with his voice and passion in some circumstances in Colorado, ended up as a health legislative fellow in the office of U.S. Senator Bill Cassidy. He's a physician as well out of Louisiana. And how can folks get in touch with you? Email or social media or whatever if they have any questions or want to follow up?
Yeah, feel free to email me. I've got a personal email. I don't read all of them, but shoot me an email at jleary21@gmail.com, and I'll do my best to respond.
I appreciate it, and thank you for coming in and allowing us to talk with you here in Washington, D.C. As for me, you can contact me, rstanton@acep.org, rstanton@acep.org. I invite you all to find your favorite player, subscribe to the podcast, give us a 5-star rating, give us feedback, and invite some friends along to join us as well so we can continue to bring the best possible information and stories and interviews out there to you here on the Frontline. And until next time, I'm Dr. Ryan Stanton, and this has been some ACEP Frontline.
If you're not on the front lines, you're on the sidelines.
Cue the music.
Bow, bow, bow.
Ding. Quiet place, all
Yeah.
alone. Da, da, da.